So from Belong to Mr. Carroll and Mr. Roe, who's Mr. Carroll?
Thank you, Chair. Deputies, Senator, my name is David Carroll. I'm Executive Director with Belong to Youth Service. Belong to is the National Lesbian, Gay, Bisexual and Transgender Youth Organisation. We're a national organisation and we aim to support and resource LGBT young people through a range of different services and supports around the country. Specifically, our drugs service is quite unique, as in that it's the only specific service working with LGBT populations around their drug use in the country. The service is not only unique, it has been a long-lasting service set up in 2007 on foot of research which showed some of the complexity of drug use when it comes to LGBT populations, which was funded, like the service has been since 2007, through the North Inner City Drugs Task Force, who we're very grateful to for this support. To give the rationale behind our submission, and indeed the submission itself, expand on it today, I'm really delighted to welcome my colleague Gerard Roe, Belong to's drugs and alcohol education and outreach worker.
Thanks for accepting our submission and inviting us here today. My name is Gerard Roe and I'm the drugs education and outreach worker. Belong to's submission to the Joint Committee is to advocate in favour of altering the present approach to sanctions for possession of certain amount of drugs for personal use. We believe that it's in the best interests of LGBT young people, and indeed all young people, that legislative change is needed to address how we treat those who are found to be in possession of drugs for their personal use. Studies have revealed that drug use is widespread among the LGBT young people and more prevalent than the general youth population. Findings from our research indicate that LGBT young people are 2 to 5 times more likely to consume drugs than their heterosexual counterparts. Many LGBT young people experience many forms of discrimination and social exclusion, most visibly in the form of homophobic and transphobic bullying. As a result, LGBT young people are often likely to suffer from poor mental health and experience high levels of suicide ideation, self-harm and adopt problems with alcohol and drug use. Statistics also illustrate the correlation between mental health and drug use. With such high levels of drug use and mental health issues among this population, surely the response needs to be dealt with as a health issue rather than one of criminal justice. For my unique position as a sole drugs worker for the LGBT community, I have seen how the current practice and legislation impacts negatively on my target audience. Belong to is not geographically bound. The young people who seek support through our services come from all different backgrounds, cultural and socio-economical. In my experience, it is mostly working class young people who come into contact with the criminal justice system. They are more likely to be stopped and certain to be found in drugs for their personal use, and therefore most likely to be criminalised. Criminalisation of drugs use often lends itself to the stigma that surrounds it. We believe that decriminalising drugs for personal use will lift barriers and stigma surrounding drugs and drug use. The resources used to criminalise possession of use and drugs could then be redirected into good evidence-based education, harm reduction, treatment and smart campaigns. The intention of current legislation is to outlaw and prevent young people from using drugs, but as research shows, it has not achieved this. Drug use and the availability of drugs is widespread across and crosses all sections of society. Surely it's realistic to think that for those using drugs and such high levels, it has now become a public health issue and should be treated as such. My local expertise is backed up by international evidence too. In Portugal, in 2001, they decriminalised all drugs in reaction to having one of the highest rates in Europe. The Irish delegation's report has shown that there's been a significant societal impact since decriminalisation. With the acknowledgement that it's still illegal to possess and sell drugs in Portugal, there has been a significant decrease in drug-related crime, overdose, HIV, particularly drug use, especially among the youth population. It is of no surprise that other countries are following suit. They treat drug use as a public health issue instead of one of criminal justice. International bodies also call for decriminalisation, for example, World Health Organization and the UN Convention of Human Rights. So in summary, Belong to is in favour of altering Ireland's present approach for possession of limited quantities of certain drugs. In our experience, current legislation actually prevents LGBT young people to seek support for their drug use for fear of criminal sanction. LGBT young people are also less inclined to disclose or discuss their drug use due to the stigma that surrounds criminality, drugs and addiction. We believe that the current legislation has been set up to outlaw and prevent drug use has not in fact achieved this in Ireland. International evidence has shown that the stated aims of the objectives of prohibition of illegal drugs have not been successful. We now have a unique opportunity to learn from the approach taken in Portugal and move towards a future that treats drug users in a more humane and dignified way by addressing drug use and addiction as primarily a health issue. We need to have an effective drug strategy that complements a new and effective drug policy, otherwise we run the risk of continuing to fail. To quote the delegation's report on the visit to Portugal, it takes a lot to make an honest person become a criminal. Thank you.
Very much, Mr. Rowe. Thank you for that. And now we move on now to the Dublin. To speak because of
That's
the
Gerard
way
from,
thing works. So, Mr. Rowe, yeah.
A question, Deputy McGrath. Yeah, the research carried out in 2007, which in effect led the opportunity for the drug service to exist. The research said that showed that Irish drug use among young LGBT adults showed that young LGBT people, young adults, are 2 to 5 times more likely to consume drugs than their heterosexual counterparts. And, you know, this comes from an array of different, obviously there's the experiential or the curiosity, we know that, but also like psychological and other societal factors. You know, as I said in my submission, LGBT young people do experience, you know, forms of discrimination and social exclusion, and could be, you know, attributed to their drug use as a reason, one of the reasons.
Okay.
Second question.
Second question is